As a medical educator, I work with physicians to learn about various aspects of physician wellness. So we talk about topics within personal wellness. So these are the things that physicians know and practice, or we should be practicing all along. So things like taking care of our sleep, our exercise, eating healthy diets, managing our stress, building community, professional development topics like setting healthy boundaries and negotiations. I also work with physicians to learn about what can be done at the organizational or institutional level for their wellness. So we know that greater than 50% of physicians in America express symptoms of burnout. So we know it's not due just to a few vulnerable physicians. It's due to the system in which we practice medicine within. So we really focus a lot of attention on what can be done to fix medicine and how care is delivered so that physicians can thrive and be the best doctors for their patients that they can be. And then I also talk about physician wellness within the larger culture of medicine. We talk about discrimination, we talk about implicit bias. We talk about those more uncomfortable topics because they exist, and if we don't talk about them, we can't shift the culture of medicine. So we really try to dig into those as well and shift medicine toward a much more supportive, welcoming environment for all physicians. My advice to physicians is to not be afraid to think about self-care and talk about self-care. It's not something we learn about in our medical training, and it's really not something we give ourselves permission for in medicine. It's really not a part of the culture of medicine. But self-care is fundamental to what we do in caring for others. Without self-care, we really can't be the best doctors that we can be. Without self-care, we can't deliver the best care to our patients. So I encourage physicians to think about their own self-care and the role that that can play in supporting them in developing their skills and offering their best self to their patients.